In this video, I'm going to show you guys what we normally do with a hallux rigidus, which is a big toe that basically doesn't bend anymore, or almost doesn't bend at all. So when this joint here is either fused, often they'll do that if you've had a bad bunion, so they had to do a surgery here, or just severe arthritis can cause this whole joint here to not bend as much. And then when you start to walk forward, it puts a lot of pressure here, which causes pain. So the first thing we'll typically do is go for a shoe, or normally a sneaker, that'll have more of a rocker. So a lot thicker under the ball of the foot here than at the tip of your toes. So when you have a rocker there, when you walk forward, the whole shoe is going to roll along with your foot. So your big toe joint here won't have to bend as much, because the rocker will take that movement kind of away from that joint there. So a shoe with a rocker is typically quite recommended for that. Sometimes we'll have shoes that have a rocker as well, but just a stiffer sole, so that'll even more take pressure away from that joint there. We'll do something similar for broken toes as well. The stiffer the front here, the more rocker there is, the less pressure should go on the ball of the foot. Another way we can treat it is with an orthotics that'll typically have a stiffener, or something quite stiff underneath, either a Morton's extension, or a spring plate, something underneath here that's going to stop the foot from bending forward. So the stiffer the sole is, it's typically going to take a lot of pressure away from here. So fractured, broken toes, typically we'll put something there, but it'll be more temporarily. But hallux rigidus, when the toe is fused like that, either something permanent or a good rocker is typically the way to go.